After finishing the medial aspect of the arm, again keeping with our principle, we go to the next thing we haven't done. So if we have already done, if we could reach the rib heads back when we were working on the head, then we've already done them. If we couldn't reach them, now is when we do them. So to review, we come up the angle of the ribs, find the xiphoid process, check where the sternum is, work between the rib heads on both sides. You can do it two hands at once, which is how you'll do it when you do it clinically. And of course, I'm showing the line here moving quickly because we're going to be going 30 to 45 seconds per point. You can do it thumbs, and after you have the rib heads open, or if you've already done the rib heads when you come around, we're going to do the spacing between the ribs. Now, on a woman, of course, we are not going to go across the breast. For obvious reasons, you don't want to be sued, you want to stay in practice. On a man, we go right across the pec muscles. But on a woman, we just go around the breast. Okay? So we start at the rib heads again, and we work the spacing between the ribs. Again, going 30 to 45 seconds, and you can use thumbs, nor knife hand. If you're standing, knife hand is easiest for most people, but you can also use thumbs. It's just a little slower. Now you want to be sure ribs are shaped. They come down and then they curve up when they come around. So they go like this. So you want to be sure you're staying on the space between the ribs, not on the rib. On the rib is very painful. Between the ribs is very comfortable. We want to go, how far do you go down? As far as you can comfortably reach and still feel like you're not getting your wrist in funny positions. Always, 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 if we're using good posture, the one foot slightly in front of each other. The knee bends. Coming from the hips, we go the hara, through the hips, up through the shoulders, out the arms, the slightly bent elbows, the lean forward. If we're standing, we bend the knee. To apply the pressure, we straighten the knee and lift. We never push off of our clients. Okay? Even if you're sitting, you still come from the hara through the hips. So whichever way you're working, depending on which aspect of the body, those principles always remain the same. So we start at the rib heads at the sternum, 30 to 45 seconds per point. Trace the ribs, and take some time. Feel which way those ribs go first. Follow those aspects. And you have to be careful when you come around this bottom rib, because remember, there are 12 ribs. The 11th and 12th ribs are called the floating ribs because they are only attached at one end, and their ends, they attach at the back and they come and they float and they end right here. When you come around here, if you hit on the end of those floating ribs, it's very uncomfortable. So we go through the main part of the body of the first 10 ribs, and then as we come across the edge here, we only come down to about here, only about 2/3 of the way down, and we're careful. If you see any discomfort on your client's face, you know you're hitting on the ends of the floating ribs. So we don't do that. So we start at the heads, we follow the spacing between the ribs. 30 to 45 seconds, one finger width at a time. Now, after you have some practice, you're going to be able to just go directly to those points. When you don't, when you're in the beginning, what you do is you go in very light until you're sure you're on the space between the ribs, and then you apply your pressure. in general, we never get stabby, we never get pokey to go to our correct pressure. We always locate the correct point and angle, and then we come in with our full pressure. We locate that point and angle at a 2 to 3 pressure level at most, and then we increase it to whatever our correct pressure level is. Holding the points, 30 to 45 seconds, following the curve around. We're going to work on what's called the cranial, we're going to do the other half. When we talk about releases, we talk about the cranial sacral releases. So this is the sacral release, at the sacrum. The sacrum, remember, we talked about that there were 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and a goose walking over Charlene's grave if you go right here. Okay? So at the bottom of the 5 lumbar vertebrae is a palm-shaped bone called the sacrum. And it's triangular, it's about a palm sized, and it's triangular shaped. So it's palm sized and triangular shaped. When you come down and you're going inferior aspect, you'll come across and you can feel as you hit the superior aspect. Superior is toward the head, remember. You're feeling the superior aspect of the sacrum. Now what's important is we're going to have to feel this from underneath. While the client is supine on her back, we're going to have to put a hand under and locate that sacrum. And then when we locate it, we're going to have to get so that our fingers are on the one aspect. There's little holes, little foramens. Okay? And these are where the nerve plexus come through the sacrum. And we have to locate those with our fingers on the opposite aspect and with the base of our thumb. So we're going to be using reverse cup hand, feeling the holes. Now go look, well, you right now want to check your anatomy book and see what the sacrum looks like. So what holes we're looking for. To get your hand in on the position we talked about, to where your fingers are on the one line of holes on the sacrum and the base of your thumb is on the other line of holes, you have to get your hand underneath. Now you're going to have to learn how to do this sacral release from both sides. Now, from whichever side you're on, and it doesn't matter because you're going to have to learn from both sides, but whatever side you're on, the hand that goes underneath, posterior hand, in position on the sacrum, with your fingers along the holes, the base of your thumb along the other set of holes. Now, the hand you have to use, because you do the sacral release from either side, the hand that goes posterior underneath the person has to be the hand that's closest to their head, the superior hand. So, if you're on their right, it has to be your left hand. Okay. Now, it's real easy. If you try to use the wrong one, it's not going to work, and you're going to feel like you're tying yourself in knots. So it's not something you're going to, but to not look awkward and have to pull it right back out and change it, always remember the hand that goes underneath, that goes towards their back, is the superior hand. Now, how do you get it there? Let me show you again how you're going to get it there with a little practice. You're going to bend your legs. Now, one of the landmarks you have to look for is the greater trochanter. Greater trochanter, look on your anatomical charts again. There's only one bone, like your arm only has one bone in the upper aspect. Your leg only has one bone in the upper aspect. This is the largest bone in the body. It's the femur. As it comes up, you feel a bump on the side right here. Right here. That's called the greater trochanter. That is not the hip bone. From the greater trochanter goes the neck of the femur into the literal hip socket. So what you're going to do with a little practice is get the base of your hand, you're going to bend your knees, get the base of your hand, the base of your thumb there, on underneath of the greater trochanter. Lift slightly and move your hand in. Now it doesn't really take all that much. You just lift, put your hand in, and drop back. But you have to know exactly where you're going. So since you don't know exactly where you're going at this point of your training, let's show you another way. Put your hand gently underneath the knee, your other hand so that you lift the leg. You lift underneath the foot to bend the leg. Now, keeping yourself away from the knee. You always have, in good body mechanics, you always have whatever aspect you're working on in front of you. So that, again, you have your one leg in front of the other, your knees slightly bent, no strain on your back. You should feel very comfortable. So I have her bent knee, I've lifted it, I have it in front of me. Now, I just rotate over and lift her pelvis with just a very easy rotation. Now I locate the sacrum. I locate where the holes are where I want my fingers. I locate where the holes are where I want the base of my thumb. I have it straight across. I bring it back, put my hand back under the leg so that very respectfully, you never want to drop someone's leg or arm. You've asked them to relax, not use any muscular tension, and let you move it. So you must be respectful and put everything down nice and gently and not expect them to take over. So now the superior hand is underneath and it's straight across her sacrum. I've got adjusted so my fingers in the one set of holes, the base of my thumbs in the other. Now we have to locate another set of bony landmarks. These are called the ASISs, the anterior superior iliac spines. Anterior is the front of the body, superior is the top, closest to the head portion. The bone is the iliac, and a spine is a ridge on that bone. So we nickname these the bikini bones. When you look at someone in a bikini, those bones you see in the front are the ASISs. So in general, they're always more superior than you think they are. You always think they're down here when they're really up here. Now the points we're looking for on these bones, we want the most superior point that's still medial. This is very important. We want the most superior point that's still medial. What we mean by that is if you follow the angle of the bone as it goes superior, there is a point where it starts to go out and it rounds and goes lateral and starts back down. So it's the most superior point that's still toward the middle. That's the point we want. Now we have to locate that point on the side closest to us, and we have to locate that point on the side farthest away from us. Since we do this from both sides, we'll describe it that way. So what we're going to do with our other arm is we're going to contact that point. We're going to take one arm and one hand and contact two bones. Now it's not as hard as it looks or as described. It just takes a little practice. Again, we need to find the ASISs, the bikini bones. So we find them, they're curved. We follow the curve toward her head superiorly. We want the most superior point that's still medial. So we follow that curve up to it's at its highest point, closest to her head, and the center. So it's the most superior point that's still medial. I mark that spot that's closest to me. By I either stare straight at it or by a position on her clothing. I remember exactly where that point is. I reach across. I find that point on the other side. Now, we're going to talk about directors of force again, our vectors of force. If we get on the medial aspect of these ASISs, with my finger at one side and my forearm catching that exact point. Now, how it's because when you have a curve on your arm and you have a curve in the bone, you have a point that is at the topmost point of that curve on each of those. You put those 2 points together and you have a precise contact. Even though you have an enormous surface here, there is a point that is farthest out on that curve. There is a point that is most anterior on this curve. You put those 2 points together, you have complete and precise control. So, I'm locating, and I'm going to say this again for emphasis because it's very important. We want the point that is the most superior that's still medial. When we're working together alone, I'm going to ask you to spout this back to me about 100 times. So you might as well start practicing now. We want the point that's most superior that's still medial on the ASISs. So I locate it closest to me, I locate it farthest away. Now, we're going to get on the medial aspect first. Now if I put my fingers on the medial aspect here, I get my forearm on the medial aspect here, this line must be straight across. What we're trying to do is remove torsional pressure on the pelvis. If your points are not directly across and perpendicular to the spine, you're going to be putting in torsional pressure instead of taking it out. Bad plan. So we have to make sure that we have those points, and we have to make sure that our arm is straight across. So we get on the medial aspect toward the center on both sides with a curve in our arm. So my fingers are on the medial aspect. My forearm has the medial aspect of the ASIS closest to me. Then I just drop the pressure in my arm. Now this is a release. This is 1 to 2 pressure. Now another key thing is if your underneath hand is straight across, it's difficult to try to put your arm directly on top of the other one. You will feel like sort of a seal. So you've got to angle your arm. You got to keep your hand straight across the sacrum, but angle your elbow out of the way because it's the top arm being straight. It's absolutely critical. The bottom hand must be straight, but the bottom arm doesn't have to be straight. Okay? So the posterior side, your hand must be straight, but your arm must be cocked out of the way so that your anterior side hand can be directly straight across. So let me repeat all that. The points we're looking for: your hand, your superior hand closest to their head, must be underneath. It must be straight across the sacrum. Your elbow must be cocked toward the head. On the anterior side, we start out with your fingers on the medial side of the point that's most superior, that's still medial. Okay? We have one edge with our fingers. We have one edge with our forearm. We drop the pressure between a 1 to a 2. We hold that for 90 seconds. Then we slip our fingers to the lateral aspect of the ASIS. We reach across with our forearm and grab the lateral aspect of the ASIS that's closest to us. Now we squeeze in toward each other. Our vector of force is medial. So we've got a vector of force lateral, pushing the ASIS away for 90 seconds. Then we slip to the lateral aspect, and we pull together, and our vector of force is medial. This arm must be straight across the top. You must have the point that's most superior, that's still medial. It's not as hard as it all sounds. Find the point, practice, it'll be okay. Now, after we've gotten those two, after we've gotten 90 seconds where our vector of force is lateral and we've got 90 seconds where our vector of force is medial, we're going to slide, keeping our superior hand straight across the sacrum. We're going to knife hand slide down until we hit the symphysis pubis. Now this looks like it's going to make somebody very nervous, but look on your anatomy, again look at your chart, see where the symphysis pubis is. You're going to stay on the superior aspect of that bone. So you're just going to come down, you're going to contact it, and again as part of the release, the pressure is 1 to 2, and you're nowhere near anything that's going to be personal on a male or a female. Trust me, feel it on yourself, work with it with someone close to you, and you're going to find out it's not anywhere near anything that's going to make anyone nervous. And it's very important you get this release. So we slide down. Now you don't want to go over that bone, however, or you're going to be in big trouble. So slide down very carefully and stay on the superior aspect of the symphysis pubis. Hold that for 90 seconds. So to review, to get your hand, your superior hand underneath, you're going to do this from both sides. In the beginning, put your hand on the superior hand with your inferior hand. Okay. Rock the pelvis over. Get your superior hand. Feel the holes in the sacrum. You have to also get up at the superior edge. You have to get the whole sacrum. Find those holes. Get straight across. Move your elbow up, keeping the hand straight across. Move your elbow up toward their head as far as possible so you can make room for your other hand. Respectfully put the leg down. Find the points on the ASISs that is most superior, that's still medial. Repeat after me. Most superior, that's still medial. Okay. Find the one that's closest to you, mark it with your eyes on their clothing, something, or stare directly at it. Reach across, find it on the other side. Put your fingers on the medial aspect. Put your forearm on the medial aspect on the exact same point. Your arm straight across. Drop the pressure, 1 to 2 for 90 seconds. Then slip your fingers to the lateral side, your forearm to the lateral side. Squeeze together. Pressure 1 to 2 for 90 seconds. Knife hand. Slide down to contact the symphysis pubis on the superior side. Hold it for 90. After we've opened up and we've done the sacral releases, now we're going to work with the hara, the tanden. The hara is where we work with our renewable chi, where we're able to add to our personal strength and to add to our chi through breathing, exercise, stretching, and other aspects we positively can influence our health, and working with it with Shiatsu. So the first thing we're going to do is we're going to move the client's hand, and we're going to put our superior hand across the sacrum again. This is just, we're going to make an energetic connection between our hands as well as a physical connection with opening up this whole area. Now also, besides working with the energetic aspects, we're going to be working just with the physical things of indigestion, all kind of Crohn's disease, Graves' disease, all manner of things working with digestion and elimination. Constipation, diarrhea, all of this. So the key element here is we want to find the parameters of the hara. The hara comes up to under the ribs and it goes down to the pubic symphysis. It comes out laterally to the inside edge of the ASISs that we were just working with. Now, to stimulate and to move along, you want to work clockwise in a circular motion. Now we're going to be using a pressure of about 3 to 4. You want to sort of get the clothing to where you're moving it but not bunching it all up. If they have sheets, it's a little easier, or if you're working directly on the skin. So you're moving in a clockwise direction. You're not banging into the bones. You don't want to bang over the ASISs. You don't want to bang over the ribs. That's very uncomfortable. So we're going to go around directly. Every once in a while you take a little second, straighten everything out, make everything clear. And you're going to go up and in underneath the ribs. Again, careful not to press on the xiphoid process. Up and in under the ribs, 45 degrees, holding for 30 to 45 seconds. Again, being careful where the floating ribs come up. So you're only going to go down to about here because you don't want to bang into the heads of those. So we go circles, not keeping within our parameters. Then we're going to go crosswise. You take the heel of the thumb all the way across, and you lift and you bring the fingers all the way across. You do this, you want to move from the pubic symphysis up toward the ribs. So you go across, lift up, fingers, go up a hand width, go across with the base of the thumb, come back with the fingers. Go across with the base of the thumb, come back with the fingers. Cross with the base of the thumb, come back with the fingers. Then you go halfway across. You go to the midline with the thumb, you come halfway back with the fingers. You go a little bit deeper than you just did when you went all the way across. Now we're going down a 4 to a 5 pressure. We've done our circles. Now this is a very basic hara release. We're going to get much more advanced at tracing the subos later. But again, this is the beginning form we're working through. So you go underneath the ribs, up and in at 45, all the way around, being careful about the heads of the floating ribs. We go clockwise with our circle. We go all the way across with the base of the thumb, all the way back with the fingers, one hand width at a time. A nice slow body rhythm. Basically, we always want to be moving. Body rhythm is about like this. We don't want to get herky-jerky. We don't want to go faster than that. Sometimes I'll demonstrate faster than that just so you don't have to watch every second of it. But remember, when you're doing it, 30 to 45 seconds, moving and thinking with the body rhythm. Do the leg lines. Now there's 3 of them on each side. We're going to call them L, 1, 2, and 3. And then on the medial side, M, 1, 2, and 3. So we're going to start. Remember this is Pam, by the way. We switched models. Hi, Pam. And this is our new water-soluble marker. Mr. Bear, or Ms. Bear. So we're going to come up. Your landmark on the side is the greater trochanter. And that's what many people think of as their hip bone when they feel along the lateral edge of the leg. It's actually, when you look on your chart, you'll see that from the greater trochanter, which is at the top of the femur, the superior aspect of the femur, from in there it goes to what's called the neck of the femur into the literal hip joint. Now the 3 lines we're going to begin. The largest muscle in the body is the gluteus maximus, which is she's laying on right here, and that comes around, and we have a hollow. And you take your hand and you palpate here. There's a nice hollow right here in between the gluteus medius. So we're going to take and start the line right here, and we're going to start with line 2. Like on the arms, line 2 is the line we're going to do first. So using our water-soluble marker. Pam's into the martial arts. I just want to make sure she knew it was water-soluble. This is L2. Now, technique varies on whether you're sitting or standing. And remember, if you're sitting, to keep your feet flat on the floor, and you still have to come from the hara through the hips, up through the shoulders, with that arm, with your basic first ballet position, your arms only slightly bent, and your good wrist position. So you can come with 2 thumbs, holding, for now, we're going to hold between 5 and 8 seconds on this point. That will vary as your skill level and things, and I'm going actually a little quicker than that. If I'm telling you the time period is 5 to 8, count to yourself at this point, keeping the thumbs close together. If you're standing, you should still be able to reach. Now there's a seam right here. The quads are the major 4 muscles on the front of the thigh, the hamstrings are the major 4 on the back. And line 2 is going right along the seam between these. So that you're going to follow, and there's a nice, if you take your 3 fingers and go equidistant, staying on this side, you'll be tracing the 3 lines. So line 2. Now when we come to the knee, you want to be careful to not put much pressure. Now we are using standard Shiatsu pressure in 6 to 8 on these lines because they're heavily muscled between there and the bone. But you have to be very careful and soft around the knee itself. Pay particular attention to the tendons and ligaments around the knee, however, because the knee, as you know from your reading, is a hinge joint. It only wants to go one direction. When you have any torsional pressure in that joint, it's like it doesn't function correctly, and it puts a lot of wear and tear on the knee. Any lateral or medial blows or injuries, for instance, the most obvious one would be football, but also in basketball, even tennis. Anything that has a cutting movement, the martial arts, anything where you're moving side to side puts a lot of torsional pressure on that joint. So we go down along line 2 using thumbs. You can use, its knife hand can be either palms up or palms down. And so if you're coming like this, Here's one variation on the standard arm position. If you're going to come with your palms up in knife hand, you can bring your elbows into your body, as opposed to this, you have to be sideways to bring them so that your fingers are in line. Now remember, you're using at least two fingers, and whatever two fingers are closest. Now, people have different situations that happen with their hands before. Some people have lost part of a finger. Some people were born with a great variation between their fingers. You can use just one. You can use two or three or four if you can get them close to in a line. You see, I can, by keeping a natural cup hand, get my four very close to in line. So I can come in this position and use all four, but you have to be, as always, coming from the laser point, coming right here, not rolling over into the nail ever, and not flattening out so that you put pressure on your own joints. Review that position again. The variation. Remember, our standard arm position is always the first ballet position, where that your arms are slightly bent, and we come to a smooth flowing line with the hand and thumb. The variation, if you're coming in here with reverse knife hand, is to bring your elbows into your belly. And then you're still coming from your hips, from your hara through your hips, up through your shoulders, down those arms. So it's still a natural lean. And remember that your foot position, to come down to the legs, that our two positions are the one foot slightly in front of each other, about shoulder width apart, with the bend, and we apply the pressure by dropping this knee. We release the pressure not by pushing off the client, but by raising, by straightening that knee. The other position, and you can switch, of course, to the other knee. The other position is the standard, shoulder width apart, feet even, coming in. Now, these two positions vary on which one is most comfortable for people depending on the position, but those are the two basic positions you must use. And even when you're seated, you maintain those positions by one foot slightly in front of the other and moving back, or evenly, just shoulder, or when you're sitting, slightly wider than shoulder width apart. So, whichever, it's keeping the line, following. Now I've drawn the lines 1, 2, and 3 on Pam's leg here. These are L1, 2, and 3 for the lateral side of the leg. 2 runs right down that center seam. 1, when you find, if you hold your fingers apart and trace the 3 lines, it's you hold them forward, you're splitting the difference. You're not going right on, and especially when you get down here in the lower leg, where you're keeping on the medial side of the tibia, so that you're tracking this line. You're not coming up on the tibia, which is very uncomfortable for the client, but you're coming right through here. And line 3, which is almost always going to be a reverse knife hand or reverse cup situation. And there's a seam for each of these lines that you can feel by. You just have to, in the beginning, you want to use your license to fish. See, later on, this kind of bouncing around is not going to be allowed, because you're going to know and you're going to feel, and you need to be, this feels very imprecise to the client and is not going to be something you're going to be able to use in clinical practice. But when you're beginning, you want to cross fiber and fish and find the seams for these lines, and just feel what the tissue, what a tsubo feels like. So it's like you want to take some time. And this is why you're working in the beginning with family and close friends, so that they allow you this extra latitude to fumble that you're not going to be able to use in clinical practice, where we are always going to appear confident and sure of ourselves, even when that's not always true. But you have to communicate that calm while you investigate, and not communicate your indecision to the client. So we go through line 2, whether seated or standing. You need to take some time to experiment and move, and remember to keep balanced, to keep coming from the hara through the hips, up through the shoulder. Very, very important that your hand position be accurate. So after you do line 2, then we go back to line 1. Okay, this is L1. Now again, whether you're standing, you can use knife hand, or you can use thumbs. Now, if you feel pressure in your thumb joint, now many of us have old hand injuries, and if your joint, you have to find the exact position of the joint that allows you to remain stable and not to cause any damage to yourself. Technique, the key element of technique is that you must use good technique so you don't hurt yourself. Because if you hurt yourself, you're not going to be able to do the client any good. So you must be centered. You must use good technique using their weight and your weight and good positioning, so that you don't feel, you should always feel when you have correct position as if you could hold it all day. It's like when I come in and I have right position and I'm coming in here, there should be no strain in my back, there should be no strain in my joints, there should be no strain in my legs. I should feel like I could hold this position all day long. Then you know you're using correct position. And to release, we never push off of the client. We straighten the knees to lift. So whether you're using knife hands, reverse cup hand or cup hands, whether you have palm up or palm down knife hands, all of these positions, the key thing to remember is you should always be comfortable in every joint. You have a lot of range of motion, still keeping within good guidelines for technique. And so it's going to be individual, up to you to make sure and check so that you use the all-day test. That no matter how you're holding the position, that you could hold that all day, because a slight variation, if you have damage to your thumbs, those in martial arts or with bad old habits in football or whatever, that we've beaten our bodies up, the positioning is very important. Very, very important to be able to maintain. Remember, the standard clinic day around here is 12 hours. No, all the students don't have to do 12 hours, but I do 12 hours in a row, no breaks, every day. And the key to that is good technique. So you can't have any pains in your back, in your arms, in your joints. So test your positioning with the all-day test. Could you hold it in that position all day? So line 1, remember these can be done standing. Remember the rule of butt. If your positioning does not feel comfortable, it's usually because your butt is in the wrong place. It means I'm leaning, or I lean, which is the number one mistake, is as you move down a line, instead of moving your feet and keeping yourself in position, that you start here and you just sort of reach. And then when I get to here, all of a sudden I'm not over my legs anymore. My center of balance is wrong, my center of gravity is wrong, and then it feels uncomfortable, and I feel uncomfortable in my back and in my joints. And remember, the rule of butt is if you are not using good technique, it's usually because your butt is in the wrong position. So that's what you have to move, to keep yourself centered as you move along these lines. Okay, so hold them 5 to 8 seconds. Don't skip any points along each of these 3 lines down the leg. Stay to the lateral side of the tibia. Do line 2 first, then line 1, then line 3. Being careful around the bony structure of the knee. I talked a little earlier about working with the knee and how we wanted to be careful and treating. Remember that it's a hinge joint, and remember not to work, that if we work close to the bone, that we back, because standard Shiatsu pressure, remember, varies. It's 6 to 8 over the heavily muscled areas. It drops down to 4 or 5 in the lightly muscled areas, and down to 2 or 3 in the very lightly muscled areas where you just have basically skin over bone. Now, when you come to the knee, remember I said to pay attention to subos. Remember, subos are the yang subos are going to feel like a knot. and to try and track those, and that as you work with them, there's a shaft down the center. And we want to find, and how you find that shaft, and we'll go over this, we'll repeat this a number of times, but in general, when you find the shaft, you want to press in into, because the more you press in, the deeper the shaft feels up to a point. And then when you hit that point, if you press any farther, then the shaft starts to shorten up again. That's too hard. So you want to go to that ideal point, is to find that angle and pressure that makes the shaft feel deepest. Okay? And I'll give you another hint. If they're wincing or if they're reacting, tightening up, that's too hard. You want the general aspect that you want to go for is we are finding the sensitivities, but we're not trying to cause anyone, undue sensitivity, undue pain. So we're finding it, not creating it, but we still want them to be as comfortable as possible. So one of the key things before we move to the lateral lines on the knees, or excuse me, the medial lines on the knees, and remember that all these are on the lateral side of the tibia and of the center, the midline of the quads. Before we move to the medial side, we want to do, again, remember joint rotation is the same for every joint. It circles both directions and then figure eights. So what this tells you is by using a soft hand, not a hard grip hand, but a soft hand, it tells you where the tension is as you go around the circle. If you come around to this point and it's very tense, remember it's the compression is going to, this is a compression that's not going to want to open. Okay? The stretch side will be happy to relax, but the compressed side will be hesitant to open. So you get a lot of information by doing these circles and figure eights. So you're not just checking the flexibility of the joint with your mind. Remember the 4 rules that we always want to work with intent. We always want to involve our intellect. We always want to use our touch to fine-tune how we work the subos. And then, of course, rule number 4 is always go for the cheap laugh. Have to keep our clients relaxed. So remember, we must go in with intent. So whenever we go to move a joint, we're always going to be with the intent of finding out all the information we can from that movement. We're never just kind of turning our minds off or, just wandering and daydreaming while we're doing this. We move slowly with body rhythm. We never go too fast. That won't tell us either. We go to a full large circle without lifting the leg in the air. We're isolating the knee. So it's a circle about this big, about this fast, and then our figure eights. And you can move your hands around. If you think as you feel the compression, the deep tension, remember the compression is when you palpate. The deeper you feel in the compression, the more concentrated and denser it feels. And that the stretched side, because if you have a compressed side, you're always going to have a stretched side. And the stretched side, while you feel tension at the surface, feels hollow underneath. So when you go through the tension, it tends to open up. Whereas with the compression, the deeper you go, the denser it feels. The lateral lines, remember that we went from hip to foot. Remember that on the lateral or the yang lines, we go down the back from superior to inferior. Now that we're going to be coming up the medial lines, M1, 2, and 3, we're going to be coming from the ankle up to the hip. So, like on the lateral side, the first line that we need to do is line 2, the one in the middle. Again, if you take 3 fingers and sort of go basically equidistant, not exactly, but basically equidistant, splitting this aspect, making sure that we're on the medial side of the tibia, and split this aspect where it goes from the tibia over to where it starts to go posterior. You can see as this curve comes around, This is line 3. So we're going to do line 2 first, the one that splits the middle. So this is starting just above, just superior, about 2 fingers from the medial malleolus. Line 2 is going to come, now this is, see if I can write upside down, M2. And M1 and M3. Now the first question that is going to appear in many people's minds is, okay, now we are coming up to the groin. We're going to stay away from the groin. We want no concept or problem with any feeling of anyone feeling nervous or in any way like you're getting close to what's going to make them nervous. The inguinal ligaments come right up through the crotch, have a lot to do with holding the whole pelvis together. Now, if we have a problem with a tilted pelvis, we will work both along the ligaments and very close to these lines, always maintaining a respectful distance, but we'll get much closer than we will unless we have a problem with a tilted pelvis. And if we're going to work any nearer than this, we're going to make sure and communicate very closely with our client and understand. And when you work where there's an area of need, where there's an area of sensitivity, the client is always going to feel that need and that sensitivity and know why we're there. But so that's why we just don't routinely come close to there at all. So when we come to the head, where we're getting close to the groin, you tail laterally away. So on each of the lines, as you come up 2, you're going to tail away. As you come up 1, you're going to tail away. And as you come up 3, you're going to tail away. Unless you feel a sensitivity. And at this point, I suggest just tailing away until you're going to have a much finer tuned sense. And when we're working with it clinically, I'll determine this and work with you on this. So when you're doing your treatments privately and when you're practicing, we want to just make sure that we maintain a respectful distance from any area around the breast or around the groin that's going to make our client nervous. So if you're sitting, this is an excellent situation. Now remember, my feet are flat on the floor. My back is not back up against the back of the chair. I'm sitting in good position, so I'm coming from my hara through my hips, up through my shoulders, and I'm going to be using reverse cup hand and finding. Now we need to introduce the concept of the soft thumb. If you're working, remember that opposing digits are what make us so versatile as a species, the opposing thumb. But we don't want to squeeze equally between the fingers and the thumb. When the line we're concentrating on is the medial line, we only use the soft thumb. See, as we're using reverse cup, we're only going to be using the thumbs as an anchor, just enough to be solid, to be braced, not equal to the pressure we're exerting in the cup hand. Remember, that comes not, and that pressure we are exerting from cup hand does not come from hand strength. It literally comes from getting our hands up and dropping our shoulders. Remember, your hands are shaped to direct the pressure, but that we're using our weight, even in a sitting position, by keeping the elbows up and dropping the shoulders and only using the thumbs to stabilize. So we're being careful again, coming around the bony protuberances of the knees, and as we come up to the groin area, we're tailing away in plenty of time. Now, you're going to say, can you do it from a standing position? Of course. You can always do these from both sitting and standing. And in this position, you can use thumbs or knife hand. And I'm going a little faster than you will when you practice. I'm only doing this to illustrate. Remember, you're holding and counting to yourself between 5 and 8 seconds. And if you feel a tsubo, a tight knot underneath, you're going to try to find that shaft and work it either longer or multiple times until you get that tsubo to open. So, whether you're using thumbs or knife hands, or you're sitting and using reverse cup with a stabilizing thumb. You can use just that stabilizing. You can use either, depending on the configuration of the leg, you're going to be using either the base or the whole length of the thumb. But remember, it's not an equal squeeze. It's just a stabilization. Now, there's two ways. You can keep your fingers right tight together to make sure you don't miss. Or a little more advanced technique is to have however many fingers you're using. If you're using 2 fingers, to have 2 fingers distance between them, and then when you move over 2 fingers, you fill the gap. So in the beginning, keep your fingers close together. It keeps your hands a little crowded, which is where as you go on, it's quite common to switch. So again, we do line 2 first. In this case, it's M2 for the medial line coming up. This is the yin side of the leg. In your reading, you'll read that the yang sides are as if someone was on all fours. The lateral or posterior side is going to be yang, and the medial or inferior or medial side is going to be yin. Now we're going to attach the meridians and points to this a little later on, but right now we want you to train your touch. We want you to feel the lines and to begin to identify the tsubos and identify that tsubo angle. Because remember, that angle could go down and then it can change on levels. So that's a subject of some of the advancements we're going to put at the end of this tape. For right now, in the beginning, identify the line, get good positioning. Okay. Always using good positioning with your arms, and remember the all-day rule, that you should be able to hold the position all day comfortably. There's also a key thing is that the people's legs are going to be movable. It's not that they planted them down in cement and you must adapt to every, you don't want to do any huge variations, but you can do small ones without any difficulty. So if you can rock the leg out to give you, and your direction should be perpendicular. Like you should never be like the leg rolling. So if you get the angle wrong, the leg's going to try to roll and move around. When you're directly perpendicular, as you begin in the beginning, see the leg, you're going to be, no matter which, and if the leg's like this, directly perpendicular is like this. And that's the other thing you can do, as you just saw, is me switch from thumbs to knife hand and back. What's important is the positioning be correct, both hands. Remember the rule of butt. If your positioning doesn't feel comfortable, it's because your butt is in the wrong place, or your angle needs to be slightly adjusted at the hands or wrists. Remember, if you get your elbows up too much, you're going to be relying only on forearm strength. And if you have them locked, you're not going to be able to move comfortably. So there needs to be a slight bit of bend. You always come from here. Remembering our all-day rule and our rule of butt, adjust your position. So we've done line 2, line 1, and line 3 is a perfect position for a reverse cup with soft thumbs. Now, the back of the knee, now you're skirting on line through, you're skirting the edge of the back of the knee. One of the major contraindications of working around the knee is the popliteal artery. This artery is very close to the surface and very easy to tear loose. So you want to be very careful working around the knee and never use excessive pressure either above the bony surfaces or the soft tissue on the back of the knee. Now we're going to do what is many people's favorite part of the treatment, the feet. Now, in the beginning, we're going to do the Achilles tendon. We're going to do a direct cup coming down. Now, this is not using a soft thumb. This is using equal pressure on both the finger and thumb side. Okay, about equidistance. How many times we do this depends on how tight it is, but generally you're going to go 2 to 3 times. Holding it from your 5 to 8 seconds each time. I go slightly faster for the illustration. But when you do it yourself, hold each point 5 to 8 seconds. Now, after we've cupped the Achilles, we're going to cross fiber. On the top of the foot is called the dorsal surface. The bottom of the foot is called the plantar surface. Okay, the first thing we're going to do is we're going to cross fiber the same way we did on the hand, using our fingers on the dorsal surface where you're crossing over as well as cross fibering. Do this a couple of times. Slowly and pull deep. Get down to the muscles. Don't just irritate the skin. So we do that on the dorsal surface, then we stabilize with the fingers and do with the thumbs on the plantar surface. Now you want to go deep and you want to spread wide, but watch their expression. You don't want to get too carried away and cause pain. So after you've cross-fibered on the plantar surface and you've cross-fibered, on the dorsal surface and cross-fibered, we're going to open the spacing between the metatarsals. We're going to go along their seam, and it's very important you don't go on the metatarsals because that's very uncomfortable, that you find the spacing between them. Now, after you've gotten practice and can feel this easily, you can do this with multiple fingers. In the beginning, just go with 1 or at most 2 so that you locate and feel where the seams between the metatarsals are so that you stay off of top of them. Again, you go your 5 to 8 seconds per. I go slightly faster while I'm illustrating. And you practice to the point where you can do this with multiple fingers. You stabilize with your thumb on the opposing side, and you're using cup hands, or you can stabilize with one hand underneath and use knife hand or individual thumb. So the important thing is that you get the spacing between the metatarsals, you don't skip any points, you hold each one now for 5 to 8 seconds. Okay. After we have opened up the space between the metatarsals, we're going to open up the base of each phalangeal joint. We're going to use a pressure that's going to go directly medial to the center of the foot. And you can do that either. It's most comfortable for most people to use reverse cup hand and just stabilize with your thumb on the other side. But it is possible to use knife or thumb depending on your hand configuration, what you have going. If you're going to use thumb, make sure that you get around so that you have your standard first position, arm and hand position. So you're going to do it along the dorsal surface, and then you're going to go along the plantar surface, getting that base of each toe along in here, right along this ridge. Okay, now after you've done the base of the phalanges, you're going to gently stretch out in their natural direction and pull on the phalanges. Now, the important thing here is that occasionally when you do this, you're going to hear a pop. Now, when you're going the natural direction of the joint, releasing that fluid in there is not harmful to the joint at all. You're spacing out and you're doing the joint a great favor. The problem comes in when people become enamored of the sound and they start yanking the digit unnatural directions, just trying to get that fluid release. So as long as you're going naturally out and pulling of each of the toes, you're going to be great. Now we're going to add one variation to the end of this. Remember that the hands and feet and ears have a full body map. Now at the top of the body map are the sinus points. So when you pull out to the edge of each toe, you're going to squeeze a little bit extra at the end and snap off. Okay. Now after you've lengthened and stretched out each joint, we're going to go back and kenbiki each of the toes, each of the phalanges. Now there's two different ways. Now kenbiki, remember, is a squeeze and a twist. Now you can, like you did on the finger, do it using 1, 2, and 3 opposing. Remember, don't just irritate the skin, reach deep. Or you can take 1 and 2 on both sides of the toe and do sort of a worm beaky coming up. So you can do it either. You want to practice both techniques so that you're fluid with both techniques. Okay. Now after you've kenbiki'd all the toes, we're going to go and cross fiber along the spine. The arch of the foot is where the spine of the body is. So it's very important. And again, the cross fiber is just like we did over the top on the dorsal surface and the bottom of the plantar surface, except we're going to do it along the side of the spine. Remember to reach deep, get the musculature, not just the skin. We'll do it on this foot so you can see it from this angle. After we've cross-fibered the spine, we're going to do what we call knuckle beaky. Now, you won't find this in any of the textbooks. It's a variation, it's a push and twist that we're going to use along the plantar surface. Using the knuckles of 2 and 3, we're pushing in deep and then twisting. So after we do the knuckle beaky, we're going to do what we call the foot wag. Now, this is a wonderful, it opens up the entire leg, not just the foot. And the key thing is you're going to pivot. You're going to hold your hands on both sides of the foot, raising the heel slightly. You can leave the heel down, but it makes it more difficult. So if you raise the heel and support it along the base of the thumb, down to about here. Okay, this callus, by the way, is not from Shiatsu. It's the throttle hand on my motorcycle. It's like I turn the throttle so much and so fast, I've got a callus there. So we're going to support it along here, and we're going to use directly superior and inferior pressure. Okay? Now we're not going to just go on the skin and just rub and irritate again. We're going to make sure and get deep. And then it's a short stroke, superior and inferior. And the point is, you'll know you're doing it right when the foot moves about this much. If it just stays like this, either they're very tight or you're not getting, you have to be below the malleoli. You have to get down to where that your contact point can be anywhere, because I can make the foot wag anywhere along that line. Okay, to review, when we do the feet, we're going to cup the Achilles evenly on both sides. We're going to do the dorsal cross fiber 2 to 3 times. We're going to do the plantar cross fiber using the thumbs 2 to 3 times. We're going to open the spacing between the metatarsals longitudinally, coming down, not on them, but in between them. We're going to use direct medial pressure on both the plantar and the dorsal and plantar surfaces at the base of each toe. So we're going to open the base of each toe. Then we're going to gently stretch out the phalanges, and we're going to pop off the tip of the sinus point. Remember not to pull too hard on those, just about a 4 to at most a 5 pressure. And if anybody complains, or if there's any wincing, you know to lighten up. Okay, then we're going to kenbiki. Remember the 2 different methods, using 1 and 2 on each half of the toe, or just using 1, 2, and 3 on one hand. Then we're going to cross fiber the spine. Okay. Then we're going to knuckle beaky, the plantar aspect of the foot. Now we're going to be working prone. Remember, supine is on their back, prone is when they're on their face. This is Charlene, who's prone. Hi, Charlene. Hi. And we're going to work on the posterior side, the yang side. Now, the first thing, you remember way back to your occipital release. The first thing we're going to do is called the reverse occipital release sacral push. So we're going to use reverse cup hand. By now you've practiced enough and seen enough that we're going to go a little quicker using the positions. If you have any trouble, go back and review on the tape. Okay, we're going to use reverse cup hand along the occipital bone. Remember, we're going not on the bone, but underneath. So we're going to be going medial and superior, up and in at 45 degrees. Now the sacrum, when you come down the lumbar region, remember your first 7 vertebrae are the cervical vertebrae, then you have 12 thoracic going the opposite direction, then you have 5 lumbar, curving the same. They're curving like this, thoracics are curving like this, cervicals are curving like this. Okay. So as we come down, now the sacrum, there is, right here at the lumbar, there's a real nice, comfortable, easy to find, and incorrect shelf. You have to be all the way on the sacrum. The sacrum is a palm-shaped bone at the end of the spine. The only thing lower is the coccyx, which goes down between the gluteal cheeks. So you're coming on top of, and the sacrum's right here, and you see it's not down here. So generally, if you look and your hand's aimed up, then you know you're wrong. It should be a nice level situation. You're using, this is release pressure, okay? So this is like a 2. And you're going to hold this pressure. The common sign of the release is a big sigh. And you just kind of go. After you've done the release, you can see you remember, look at your charts, and you can see that a vertebra, the part that points up is the spinous process. Okay, and then you have the transverse processes, which go to the sides. So when you feel along the spine, the bump, 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 bump is coming along, and that's the spinous processes. So we're going to work on the trough next to them. We never work directly on the spinous processes. Again, you keep with the same principle of working directly on bone is incorrect in most areas other than the cranial or sacral releases. In general, though, we don't work on the bony protuberances. We work on the troughs next to them. So the inner and outer bladder lines, the inner line is this trough right next to the spinous processes. The outer bladder line is 2 sun. Now a sun is an ancient unit of measurement. Basically, it's about the width of a finger. There are 12 sun between the wrist fold and the elbow fold on the person you're working on. So you have to judge by how close your finger width matches to them. But in general, it's about 2 fingers. So you come out and you look for that trough that's 2 fingers out from the inner bladder trough, and that's the second bladder. So on Charlene, now these meridians and these lines are all bilateral, which means they're both sides of the body. Okay. There's inner bladder, and the 2 sun outline for outer bladder is right here. Now we're going to work these. Again, you have a variety of positions. You can use thumb. You go 1 vertebra at a time. Go 5 to 8 seconds. Have your proper positioning. Okay, so that you lean. This is very important that you come from the hara through the hips up through the shoulders. You slightly bent arms. You lift with your leg. You bring your pressure down. Now this is full 6 to 8 pressure. Now when you're practicing, though, use less pressure to make sure that you get the line right and that you find it. And then as you practice and become more facile, then you'll use more pressure. Now here's a term generally you want to work. You want to press down on the exhale, release up on the inhale. Now the pressure is directly anterior. So now I'm 6 feet tall. So I can reach and keep my pressure by adjusting the angle of the wrist directly medial all the way through. If you're a little shorter or the table's a little high for you, don't go any farther than you can reach going directly anterior. So if you only can come to here, going directly anterior, then you come to the side and use knife hand to finish up. Now it's also possible to use knife hand from the very beginning. And I'm saying, what if they're breathing at a different rate than you are? If you breathe demonstratively so that they can hear it, they'll pattern their breathing the same as yours. So you go down for inner bladder, then you do outer bladder. You go all the way until you feel the superior edge of the sacrum, which you located earlier. It's a triangular shaped bone. Come the chart in your book. It's about the size of your palm. You come down in both these bladder lines to the superior aspect of the sacrum. Now after you've done both bladder lines, you're going to come around and we're going to do the shoulder rotations just like we did on the anterior side. So we're going to do full, so you get control of the shoulder by using cup hand and putting the AC joint, the acromioclavicular joint. Again, look at your book, you know that there are 2 major joints of the shoulder. Both of them meet up at the front of the scapula, the shoulder bone, where the clavicle, your collarbone, comes over. And that meets, that's the point, or right here, this is the AC joint. Joints are named for the 2 bones, again, that come together to meet them, or the bone and the fossa that the bone articulates in. So it's the acromioclavicular joint where the humerus, your upper arm bone, comes up and meets the front of the scapula again, is at the glenohumeral fossa. So that's called the glenohumeral joint. So you get a hold so you control, when you control the AC joint, you can see that on most people, you can immediately make the scapula stand up. Now, if they're heavily muscled weightlifters, you're going to have a lot more difficulty, particularly if their flexibility is low. But on most people, you can see that you'll be able to lift and get control. And so you're going to circle. Now, you're going to circle on the side closest to you. And you're going to circle both directions and figure 8. So you lift high and you rock back and you push forward. You lift high and you rock back and you push forward. And you go the other direction. You rock back, you go high, you push forward. You rock them back, you go high, you push forward. Now figure 8, this is a little tricky with the shoulder, it takes a little practice. But you go half the distance up, and then you go down in half the distance, so that your figure 8 is on its side, like the infinity sign. So circle both directions and figure 8. Now, the same way we worked on the foot, where we worked the spaces between the metatarsals, and the same way we worked on the hand, the space between the metacarpals, we're going to work the spaces. We're going to erase these lines, and then I'm going to show you the spaces between the ribs. So we're going to go on the spaces between the ribs. So you're going to feel around. Now, you've got a lot more musculature to feel through than you do on the hands or feet. But in the same way, you want to feel around and feel the rib here and the space between it. So take and gently palpate. Remember, don't push directly on the spinaeus processes. This is from inner bladder out. And you want to find where those are. And you got the rib spaces between going up to the scapula. So you feel where those are. And then when you've got them, I suggest you go with 2 fingers to find a space, so you can do 4 fingers at a time. Make sure you're on the space. And again, in general, breathe out, lift up. Now, generally we're getting between the rib spaces, but you can go across the scapula. There's the center, again, look at your chart, the spine of the scapula goes through there. There are a lot of muscles attached to that spine. So when you go between the ribs and then you go across, feeling to get those muscle attachments across that scapular spine. Okay. The pressure is directly perpendicular to the surface you're working on, what we call directly anterior. Then you go back up and you go to the next rib. Now here you're going to come to where the inferior point of the scapula, and now you're just going to go around it on the rib. Okay? So the first time you went up and you went between the spaces of the ribs up to where you got to the scapula, then you went on either side of the scapular spine. When you go for the second set, you're going to come down and your first set's going to stop at the scapula. You come across to here, and then you're going to keep going around. See, here's your inferior point to the scapula, and you follow the rib. Now remember, ribs, look at your rib chart and see how they curve and feel how they come down and then go back. Come down to here and then they come back. So one rib goes like this. So they curve. So you have to feel that curve and go with that spaces between them. Now, also remember, as you're coming down, that the 11th and 12th ribs are called floating ribs because they're not connected coming up to the sternum, so that their ends stop down here. After coming around to protect the kidneys underneath here, they come around and stop. You do not want to press on those heads. It's very uncomfortable. So as you get down and you work these ribs, and you can work them individually or two at a time. I start out just suggesting you do them individually, work up to two at a time, and then you work up to where you can do 4 at a time. But you come through here, when you come to the end of these, don't press on the ends of the floating ribs. So you just follow them around to here and stop. Okay, so to review quickly, you rotate to the shoulder, both directions, scapula by controlling the AC joints on your anterior side. I'll do it reverse. You can reach across and do this as long as you have good positioning, but generally it's easier to work on the same side. But to illustrate, you control the AC joint and you control the inferior edge of the scapula. You rotate, big circles, rocking back to lift, going forward to push down, both directions, the figure 8. Then you've worked the ribs going directly, and you can use thumbs if you like to isolate just one rib, or you can use fingers to isolate 2 ribs at a time. And then when you work, the one thing you want to get away from is you want to make sure that you keep working from the laser points on the fingers, and that it's a hand position. Remember, your hand should always look like Michelangelo painted it. That's a natural line. Okay, no this kind of bendy, kind of twisted kind of stuff. So you're always got good position. Slightly bent arms, everything solid, using the all-day test. Could I hold this position all day and feel comfortable? To be correct. So you've come down and you've worked all the ribs down to here. Now you remember from the other side, we did a sacral release. From this side, we're going to do what's called a reverse sacral release. Now we still want to get the most superior point that's still medial, but we're going to reach underneath of the iliac spines on the anterior side. We're going to reach under and control those. And generally, I'll turn sideways, we're just going to reach around and get those iliac spines, and we're going to over-compress. Again, it's a release, just using a tube pressure. And then we're going to push with the base of the thumbs to open up the sacroiliac joint. Okay, and that's between where the sacrum and the ilium meet. There's a suture right there, and that's a very important joint to keep open. So you just slide your hand under, find that most superior point that's still medial. You go with a lateral direction first, and a 2 pressure. When you feel the release, or 45 seconds, whichever comes first at this point. And if you don't feel the release, don't fret, because it's a thing that comes as your sensitivity increases as you practice. And then you come staying in the same position, releasing with the fingers and just letting them lie. Come with the base of the thumbs, going medially for 45 seconds. Now, when we come to move down the legs, you say, well, what about the arms? Well, we've done the arms very well from the other side. If they had a hand or a wrist problem, you could do it from this side, but it's much more awkward to try to work an arm when they're prone. So we do them very thoroughly while they're supine, while they're on their back. And then we concentrate on the legs. Now the lines coming down on the legs, we're going to have 3 on the lateral side, 1, 2, and 3. I'll draw them in just a moment. And then we're going to have 3 on the medial side. Again, M1, 2, and 3. Starting at the aspect, the most superior aspect, the closest toward the ceiling. And then we're going to add 1 going right down the middle of the leg from this side. See, the other side, we rock the lines around to cover that, but on the back, on the posterior side, we're going to come right down. So we're going to start those lines. Remember, the greater trochanter is our bony landmark right here. And you feel that. You just come up and you feel. And there's the greater trochanter. And then where we're going to start is that nice gluteal hollow. right here. Just posterior and superior of the greater trochanter is where we're going to start all of these lines. We're going to come down, and again we're going to do 2 first, right down the middle, then we're going to do 1, and we're going to do 3. So we start these lines right here. Greater trochanter, just superior and medial. There's a hollow. You put your fingers down, you palpate, there's a hollow right here. Okay, we're going to start at that point right there, right in the center of that hollow. And then from there, from this point right here, we're going to come and line 2 comes right down this center, and 1. And remember our contraindication against working anywhere near the popliteal artery on the back side. So this again is L1, L2, and L3. We'll go right down the middle. Okay, and again, if you take your fingers and you draw that'll give you an idea about separating them. And then on the medial side, just draw these on the other leg. Okay. There's M2. M1, M3. And then we're going to add the 1 line starting right under the ischial tuberosity, coming right down the center. Okay, we're going to call that center 1. So these points again, greater trochanter, just superior, medial, right here. Now you can work them, again, using all your hand positions. Okay, if you're going to work from, you can even work from the opposite side, using reverse cup. I can come down. Of course, I'd start with L2, and I can do reverse cup through here. I need to check it. And then I can use thumbs. I'm going a little quicker than you would normally, of course, avoiding the back of the knee. Remember that contraindication, very important contraindication to working the back of the knee. Remember, you're going to stay on the medial side, okay, or you're going to stay on this side. It would be sort of the superior aspect from here, because it's on top of the tib-fib line there. So you've got the fibula coming along here, and you're going to stay on this side of it. So line 2, line 1, line 3, and then it's very important, 2 very important points. Right here at the gluteal fold, right here at the fold of the cheek, you feel a point in each side. Now, this point is called the ischial tuberosity. And you look on your charts and you see that's the point that people sit on. It's not their hip bone. It's actually the basis. It's a bottom, it's a hollow bone, and it comes down to a point. Whereas the greater trochanter, remember, goes directly into the hip. The ischial tuberosity is more inferior of that. And so you want to get underneath that. Meaning you want to go anterior of that point, and you want to go directly superior. The other important point is we started these over here. There's a point where you come down the bladder line that's right in the center. If you take the cheek right over here, remember we started these for the lines coming up here, the ischial tuberosity here. There's a hollow But you can palpate right here. There's a very important point there, and I usually do it simultaneously with doing this point under the ischial tuberosity. So, if you're working same side, which is the way you normally will, but you can work it from opposite side. If you're working same side, you can work with thumbs, or you can work with knife hand. You start with your number 2, which I usually like to work with thumbs. Make sure you have your good positioning, your foot in front of each other, but not too far apart, knee slightly bent, coming from the hara through the hips, up through the shoulder, your slightly bent arms. Avoiding the back of the knee. Go a little quicker than you would. Remember, you're going to go at 5 to 8 seconds per. And NRC1, coming underneath, okay, you're going anterior, underneath the ischial tuberosity. And then you're coming up and you're finding this hollow, this gluteal hollow, and right down in the center of it. Now these important points, these subos, they call out, you feel them, and you feel that center line. And after you get these to open up, remember on a subo, it's going to feel like a notch. You're trying to find that center shaft that feels deepest. And when you get it correct and the right pressure that it feels deepest, you hold that for your 5 to 8 seconds. And then it can be, if it's a knotted subo, you can do it 2, 3, 4 times and get it to open. Now, there are going to be times we hold it to get it to open, and there are going to be times we do it repeated. Right now, I just want you to work on both of them. Holding it for those 5 to 8 seconds, and then repeating. And then holding it for longer. When you find those subo knots, not on every point, but right now you hold for 5 to 8 seconds, and as you work, you'll find those subos more and more. Then you have to work on angle identification. So we've done the lateral lines, we've done our center line. Don't put too much pressure on the back of the Achilles tendon where it attaches either. We just come up about to here. You'll feel going to become very ropey, and you don't work on that rope. You only work where it's broad. So you do the lateral side, the center, and then you do the medial. Now I'm switching legs so that it's more apparent for you, but generally you'd stay on that same side, and you do it the same way. You'd use reverse cup with a soft thumb to stabilize. Remember, you're not squeezing hard with the thumb, you're just using that to stabilize. You do M2, the medial line 2 first, the one in the middle. Again, avoid the back of the knee. And you come back to M1. Avoiding the back of the knee. take M1 all the way back up. You get under that ischial tuberosity. And check that again. Reverse cup hands. For M3. Now again, you have to experiment. You have to feel where those channels are, where those seams and lines are. Now later on, you're going to learn the specific meridians. Right now, we're just calling these lines. These are general beginner lines to get you to appreciate and feel where these go. Later on, we're going to give you the specific meridians and the specific points, and they're going to vary a little bit from this. We work on a step learning program. Feel the seams, because it's a lot. It can be very overwhelming to say, all right, now find bladder 40. So right now, we want to feel the body and get you working right away, and get you doing people good right away while you're practicing and you're finding these lines. And you're coming through and you're doing, and you're helping, you're learning where these seams are, you're trying to learn what a subo is. Okay, remember, those are the knots. In Western, they're called trigger points. We call them subos. They're access points for the chi flow. They're blocks that we want to open up so that the chi flow will flow better and be more balanced. So we have to do a lot of playing around to do that. Now another thing, after you've opened these lines and in conjunction with working these, we're going to again circle the knee. Now from the other side, we lifted and we circled around. From this side, we're going to do it a little bit differently. We're going to reach across, take the heel, lift the knee. Now we cup our one hand, and you can see we cup around the knee. And now we circle the knee, both directions. And our figure eights. Every joint you can circle both directions and do the figure eights, which tell us, again, we're looking for pressure. We're always working with intent. And then we're always applying what we know. You're studying your bone names, your muscle name, function, origin, and insertion. Then we're going to work with the meridians. Then we're going to work with the points. All of these things help. Shiatsu is wonderful in that you can start helping people right away, and the more and more you learn, and the more advanced as student you become, and it's a lifelong study. This is a beginning program. It's a very intensive beginning program, but it's just a beginning program. You're going to go on and study this the rest of your life and be helping people, and it's a wonderful, it's like this is the greatest job in the world. People hurt, they come in, you help them, they love you because you help them, then they pay you, and then you get to set the hours. I can't find a downside. It's a wonderful job. So, getting back to the knee, we circle both directions, we figure eighted, we've done our lines, we've done our lateral lines, we've done our medial lines, we've done our center line coming down. To finish up, we're going to do our knuckle beaky again. On the soles of the feet. And that's going to be our finisher. Now, after you practice the basic form and you've gotten and you feel where you know where the lateral and medial lines are, you know where that center line is on the posterior side of the leg, you can find the spacing between the ribs, you know where inner and outer bladder is. There's a technique that I want you to start practicing, and you're not going to find this in any of your texts. It's something that we pioneered here. We're going to use the spinous processes as bony landmarks to tell us about what the torsional pressures on the spine are. And then we're not going to pretend to be chiropractors. We're not going to try to make adjustments, but we are going to try to remove the muscular tension that is pulling because the spinous processes are these wonderful little like rows of cones that tell us where the tension's going. And you have to learn a technique that we call the Geiger counter finger technique. It's where you let your hand hang down very lightly like a Geiger counter needle or a divining rod. You know, you can't hold it too tight. And you want to trace spinous processes. And remember, they all stick up on the dorsal surface, like this. So it should go bump, 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 bump as you move your finger down the spine. Now what you're doing visually is you're following which way that it goes, in laterally and medially. And then you're feeling when the bumps fall away from you. Now you have to remember your curves, that the cervical curve when someone's prone is this direction, the thoracic curve is the other way, and then the lumbar curve is the same direction as the cervical curve. But you're going to, this protuberance, everybody has this bump right here at the base of their neck. The last articulating vertebra is C6. It's the last one that flexes. C7 and T1 are bonded together, and they move, but only slightly. So this bump you always feel is that C7 T1 landmark. It's that bony protuberance bump that you feel right here. Now generally that bump is going to be pulled one way or the other. And what we found is that it's normally pulled in the direction of handedness. So someone's right-handed, they overdevelop the right side, it yanks the vertebra that direction. So your first curve in a right-handed person, you do your Geiger counter finger from the C7T1 protuberance, is normally pulled slightly to the right. Then you have to trace where it comes back to the center, okay? From the bony protuberance to where it comes back to the center, we call the first changeover. That's a C curve, okay? So we're going to draw this on Charlene again. Right here is the C7T1 bony protuberance. When you follow her vertebra, they go out like this, and then they come back here. This is the first C curve. This is the first changeover. Now as we follow it down, when gravity pushes down equally, and anytime the spine is pulled one direction, your body's going to try to compensate, go in the other direction. So if you follow now, it's like the lower half is pulled to the left. Now, we want to keep track of, and when you have a C curve one direction and a C curve the other direction, that makes an S curve. Two of them together. This is the second changeover. So from the C7T1 bony protuberance, and this is, remember, this, you have to feel this. You don't just assume this. So you have to have intent. You have to go looking for it. You have your intellect that you know that there's going to be a curve, but you have to use your touch to tell you exactly which way it's going to go. So from the protuberance, from C7T1 to where it comes back to center, we call the first changeover. From where it then goes the compensatory curve, till it comes back to the center, that's the second changeover. And then we've normally got, and Charlene has, where it comes out a little bit to the right again. And then there's going to be, in this lumbar area, above, here's the edges of the sacrum, and you got to learn to feel these. So the top, the superior edge, the upper edge of the sacrum, right in front of it, because of these pressures, there's going to be a little bit of pull in the pelvis. And where it's pulled superior, there's going to be a compression. And remember the difference between the compression and the stretch side. The compressed side feels denser, the deeper that you palpate. And while the stretch side has tension at the surface, as you go through it, it feels hollow. I mean, it just, the compressed side just gets denser and denser and denser as you go down. The stretch side, you feel a tension at the surface, but as you go down, it's hollow. Now, these are unusual concepts and unusual feelings until you start. See, I just want you to practice trying to feel. Now, a left-handed person could go the other way. Now, just because they're not left-handed or right-handed, then you have accidents and falling out of a tree and car accidents and whiplashes. All of these things will affect these bony landmarks. So you have to learn to feel when, when they're all going bump, 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 bump about the same height, and then of course they're going to go posterior when the curve changes in the lumbar. But as you come through the thoracic, sometimes they're excessively posterior here, or excessively anterior here. That's when you come around and all of a sudden they disappear, or
when they're going anterior in the cervical and lumbar curves, if they disappear, they're going excessively anterior. If you bump, boom, then they're going excessively posterior. So you go do, oh, that's really high. And then when you look, you'll see, like when you see one vertebra or another sticking up, that's excessively posterior compared to its mates. So this tells us, and by opening up the muscular tension around, because our contention is the vertebrae aren't wandering out of there, they're being pulled out by this muscular tension, or impacts. And see, if you have an impact, the body clamps all the musculature around it, like in a car accident. MVA stands for motor vehicle accidents. And in an MVA, you have a lot of blows and things can get knocked out of alignment, and then the musculature clamps down to keep it from moving and getting hurt anymore. But we have to take that tension out, and you can work very well in conjunction with chiropractors. You take out the muscular tension, they get the structure in line. It's a hand-in-glove situation. We work very, very well with chiropractors. So these are the situations I want you to practice. Geiger counter finger, bump, 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 bump. And the common problem is falling into the inner bladder. You go, so when it's smooth, you know you've fallen into the bladder line. If you have trouble following the bump, 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 an alternative, just to help you, is to put a finger in each bladder line and follow where they go. That can help you refine your touch, but it's a lot easier and faster when you become facile. So practice both ways. And don't feel frustrated if you have trouble. Remember, we're going to be working with you individually on getting this situation and getting these skills learned. These are just intros so you can start practicing and training your touch. We're going to work with you individually on fine-tuning it and making sure you get it right. Now there's another situation in the sacrum. In the beginning, you just practice coming down to it, and then we sort of skip around it. Now, after you practice a little bit, I want you to continue on inner bladder and find, when you look at a picture of the sacrum, there's all these, these holes, these foramens, excuse me. And these foramens have nerves passing through them. And you want to find and access any subos you feel in these holes, all the way up and all the way down to the coccyx. Now, working with the coccyx if it's lateral medial is a much more advanced technique that I don't want you to try right now. But later on, you're going to continue on the line and work the subos on which side the coccyx is being pulled to. Now, a subo always remains the same in that you want to find the deepest angle. And that you start out with a gentle pressure until you find the center of the subo. Then you add on your pressure until the subo feels deepest, and then it starts to shorten. Then you back up till it feels deepest again. And then you either hold that for 8 seconds, release, and repeat 3 to 5 times. Or you hold it until you feel it open up. Now the two of those techniques will vary depending on the specific subo. And working with concepts of yin and yang and whether you're trying to stimulate or sedate. These are things that we'll fine-tune later on. But for right now, practice getting these C curves down. Practice feeling the holes, the foramens in the sacrum. Feel where the coccyx is. Now, coming down to the coccyx, this is not going, you're not getting anywhere near the genitalia where you're going to make somebody nervous. The coccyx is still way above that. So this does not feel invasive. Okay. And remember, the bladder 36, our points right in the gluteal hollow, underneath the ischial tuberosity, the side, the lateral aspect of the gluteal hollow here, the posterior gluteal hollow where we start our leg lines. Clinic and school, we use body cushions on top of massage tables. The reason we do this is because the natural curves built into your spine, the cervical, thoracic, lumbar curves, if you make them conform to a flat table, you're putting pressure on those curves. Whereas if this cushion system supports those curves, and it's basically just much more comfortable for the client. Now you're going to be assisting if how the client's dress is up to them. Some people like to have very minimal clothing. Then we use sheets, and we'll show you how we do draping. But many clients work through light, comfortable clothing. So in that case, and we'll demonstrate that case first. Okay, you're with them when they come into the clinic. They filled out their charts, and they're going to get ready to get on the table. You explain that we're going to begin supine with them on their back. In the clinic, we say anatomical terms and topographic anatomical terms two ways. We say them the technical medical definition, and then we say the popular sort of common English translation, so that they know what they both are, so that when they're in their doctor's office, they start to know medical terms, because we don't want nomenclature to separate us from our clients. So we come in and we say that this is a body cushion. The reason we're going to use this is that it supports their body curves in their natural position, and it's basically more comfortable. And the way we do this is we're going to take this out. So this is going to be under the knees. We're going to have you sit right here, and we're going to support your neck as you come down, and we're going to have you slide up and down until your back feels most comfortable. Okay, then we're going to support your neck in whatever position that is, because your head may only be to here if you continue to sit here, or it may be all the way up here, whereupon, depending on how big the person is, some people like to put their head directly on this. Other people, we have a shim. The Bernie Siegel book, shim is our most common one to bring it up. So Charlene, if you would come, please. Now, the other thing you're going to do is you're going to reach underneath and pull out the stool so they have a shorter step up. So you sit here. Support their neck, their cervical curve on the way down. And then you say, how does that feel?
That's good.
Okay, if that feels comfortable for them, you want your neck a little higher.
Yeah.
Okay. Then you take your Bernie Siegel shim. Without pulling their hair, you lift up the neck piece, and how does that feel?
That's good.
Okay. Then you come and you take this cushion, you say, I'm going to put this under your knees. This is going to take the strain off your lower back. Okay, you want to make sure that it's supported so that they're comfortable. Like this, you're putting pressure on the knee. So it comes back until the legs fall comfortably. Everything's loose and relaxed. You need to be sure that they're even side to side, that the same amount of cushion shows on either side, or if they're very big, that they overlap the cushion equally on both sides. So if they're not equal on the cushion, you go to where the cushion side is short. Like if this side was short, for example, you would come to this side, you would take a hold of the cushion, place a hand here, and move it out until it was equal. So you make sure and you say, now, does that feel comfortable for you?
Yeah.
Great. Then, of course, so you don't trip, you move the stool back underneath, and you begin your treatment. When it comes time to turn them, you say, okay, Charlene, I'm going to take the cushion out from under your knees, and we're going to sit up. Now, this is very important. You get their hand in what we call the soul shake, where you wrap around their thumb, and you're holding it like here. Now, if they're very big, before you do that, you're going to take their ankles and bring them over to the edge of the table. Now, you're twisting their lower back, so as soon as you do that, you come right here, you go to the soul shake, you come over and you support under their cervical curve, and you lift them up. Now their legs slide sideways, and it helps lift them. Now, if they're much smaller than you, you may not need to move their legs. Or if they're very athletic, or, they may not be able to do that. But if they're at all big or they're all infirm, now never try to lock up their opposite hand. If their back feels weak, they're going to want to put that hand behind them. So we review that again.
Okay, Charlene, I'm going to take the cushion out from under your knees. We never called things pillows. We don't use any bed references. I slide her ankles over to the side. I immediately get her in the sole shape. Support under her neck, keeping my legs underneath me. I bend my legs and I lift. I don't reach and lift and put pressure on my back. Okay? And then as she turns around, you take Bernie out. You put the face paper down. She centers herself. We come back and say, now I'm going to put this under your feet. Now, if you have this up too far, put too much pressure on the tibias. So you want to pull it back until the feet gently break up. And then they're normally going to have their arms either forward, like this. And you're going to have to say, now I need your arm in one of two positions, Charlene. I either need them down like this or back like this, whichever is more comfortable for you. Now, if they've been, when they were supine, if their head was here, you may have moved these arm cushions down here. Now, never move them lower than the bottom edge of this, or they're going to be on the wood, and that's uncomfortable. But if they're lower down like this, then you take these out. You angle them down as you push them in. Slide them sideways and then support their arms. And you begin your treatment from there. And when you're done with this side of the treatment, say, Charlene, I'm going to take this cushion out from under your feet. When you're ready, we'll go ahead and sit up. Now, they'll let them choose which way they want to get up, but you stay close. Like just with a hand on their shoulder, on their hip, because people can be woozy and they can feel like they may be a little faint, and you just want to be sure and let them know that you're right there, they're safe, they're solid. And then you come over, and to shorten their step, you pull that stool out. For a client who's going to use sheets, you take the knee cushion off, and you put down this red anti-slip pad. That keeps the sheet from sliding over the vinyl of the body cushion. And you get out of the cabinets a fit sheet for the bottom. It doesn't have to be fitted, but it's nice. The fitted end goes over the end of the table. You grab the top end of it, slide it around the arm cushions, and neaten it out. Then you put down the knee cushion in approximately the right place. You use a non-fitted sheet, and I've actually had clients request that you be sure not to use two prints. So if you use one print, you have to use a solid for the other one. I generally leave these folded in half. If the client wants them larger than that, they'll unfold them themselves. Another key thing is the folded edge needs to be toward the north or toward the outside, because if you leave the unfolded edge, they'll get in between it on the top, and then they'll be stuck and won't be able to turn over. So after you've done it like that, you fold back the edge. In the wintertime, before you'd fold back this edge, you'd also put the quilt on top of the top one and fold the top sheet back with the quilt. Okay, and then the last thing you would do to get ready for it is bring the stool out to shorten their step. So then the clients, if they're working and they're going to use this setup and they're going to be having minimal clothing on, you're not going to be in the room with them when they get on the table. So you have to make sure they have the setup where they're going to go supine first, sit here, lie back, make sure their back is comfortable. Now you only have to do this with people their first time, or maybe their first and second times, but then they know the drill. So, but you just have to have it set up nice and neat. The little detail kind of things make people feel a great deal more comfortable. You don't have to get too obsessive about it, but just not sloppy. So you have that ready, they come in, the client's ready, you double check their neck if you don't have Bernie in, or if they need Bernie taken out, to whatever, that their neck height is comfortable for them, that they're supported, that the knee cushion is in the correct place, that their feet are down, that they're even side to side on the cushion, and you're ready to do your treatments. Now basically, you want to make sure that you don't ever uncover anything but what you're working on, and that you never embarrass them. And remember, you can easily work through the sheet. The biggest advantage of this is you don't have buckles, seams, buttons, and things over key areas where you're trying to work. So there are times when you'll want to see, but generally you'll just want to work over what's, and if you're working over this, over the hara area, you're just going to work through the sheet. Now on the legs, if you go to work, make sure and start at the foot, and don't come anywhere near uncovering the groin. If you have to work here, you work underneath of it. But you're basically, as long as you only uncover what you're working on, and you're respectful and give them plenty of leeway, they're going to feel very safe and very comfortable, and you won't get sued. Now when you go to turn over in this draped position, this is a little bit of a key thing. The first thing you want to do is take out the knee cushion, set it closely to the side. You say, now I'm going to take the edges of the sheet, Charlene, and if you turn away from me, you see when they turn away, nothing is ever uncovered. And then when they get to here, you take and say, if you lift your face just a moment, I'll give you a little face paper, which is more comfortable. There's a little face paper routine that we'll show you in person on how to quickly do that. And you come back and you replace the cushion, this time under their feet, with a slight break to their feet. And then you can uncover the back to work on whatever you need. Working through the sheets, you uncover the leg, be sure and be respectful. Never, ever, ever do you want anyone to feel uncomfortable. Now in this case, when they go to get up, you can't be here. So you want to, when you go outside, you want to stay close by the door, and you want to make sure they're all right. So you take the cushion out. I say, I'm taking the cushion out, Charlene. You make sure and take the stool out. You say, I'll be just outside if you need any help, and we'll see you out at the desk when you're ready.